Welcome to the Lifestyle MD podcast, a podcast dedicated to high-achieving women who are conquering their careers while striving for total wellness. I am Dr. Angela Andrews, and I am thrilled to be your guide on this journey. Hello, this is Dr. Andrews. I'm a Lifestyle MD, and I am so excited to have a return guest, Dr. Carrie Denny, ND. She is a licensed naturopath, and she is also a good friend and colleague, and just so excited to bring her on today. Today, we're going to talk about a really interesting topic, and that is how doctors, like traditional, conventionally trained doctors, can work with naturopathic doctors and why. Why is that even a thing? Why should we care? So that's what the topic of our conversation is today. We'll have more conversations in the future. If there's anything you want to hear in this realm, please feel free to email me at angelalifestylemd@gmail.com. And I would love to hear what you have to say. So, Carrie, how are you?
I'm wonderful. Thank you for having me. I so enjoy our chats as always.
Likewise. Oh, so fantastic. We just don't get to do it enough. It feels like it's never enough.
It's so true.
So let's remind our guest a little bit more about who you are and what you do.
Yeah. So as Dr. Angela said, I am Dr. Carrie Denny. I am a licensed naturopathic doctor and acupuncturist, and I own my own clinic in Grand Rapids, Michigan called Vibrant Wellness, where I offer naturopathic consultations, nutritional consultations, acupuncture, and then I also have a holistic wellness program that I just launched. So that is what I do. And just a little brief explanation about naturopathic medicine, because people always ask what it is, right? It's very similar to the idea of holistic medicine, but we are basically supporting the body's natural ability to heal itself. We combine the wisdom of like traditional medicine that was often used like in indigenous communities with the rigors of modern science and medicine. And so I did attend a 4-year accredited U.S. Department of Education accredited medical school. I went through all the basic sciences and the clinical sciences. And then in addition to that, I learned my naturopathic therapies, which include things like botanical medicine or herbal medicine, and also interactions with pharmaceuticals, homeopathy, again, like I said, acupuncture, nutrition. We get a little counseling. It's kind of just a marrying of, like I said, both of those forms of medicine. So that is what I do, and I love it very much. It's very fulfilling.
Awesome. Thank you so much for sharing that bit of information. A lot of people do have that question, right? I mean, I definitely had that question. Like, I don't understand how this is work, but it's interesting as we have grown in our partnership and grown as colleagues and friends, we have so much in common in terms of our perspective and view on what it means to be healthy and how to lead people in that direction. And I come at it from a conventionally trained perspective, and you come at it from a naturopathic trained perspective. And yet somehow we meet. Right?
We are aligned.
We're aligned, right? So this is a great conversation. In full disclosure, so I am Dr. Carrie Denny, supervising physician, because in the state of Michigan, she cannot operate independently. She has to be under a supervising physician. So that is the nature of our relationship. I have not started working with you as a patient yet, but we've been talking about it.
Yeah.
So we'll have to talk about that more later, because now I think I got arthritis in my fingers.
Oh, Lord. Come on down. Let me put some needles in you.
That's what, yes, exactly. Can we do some acupuncture? We need to set talking about that for a minute. So after this, let's do that. Let's get that set up. So you have worked with other doctors for a long time. And one of the questions I have for you is, in the past, or kind of since you've been practicing, have your relationships with other physicians been more collaborative in nature? Or is it just kind of, tell us a little bit more about what that's been like for you in your journey?
Absolutely. So you are the fourth medical doctor that I have worked with. And so it's been a varied experience. The first medical doctor is actually a trained cardiologist, but at the time he was not practicing as a typical cardiologist. He was actually very much into more holistic things, if you will. And so, but he still very much oversaw the practice that I was working at, right? And so our relationship was a working relationship, I'll say. The second doctor that I had is an osteopathic doctor. and she oversaw our practice, and that relationship was really just more formal. We didn't really have a good rapport. And then the last doctor that I worked with, a little bit more integrative, but still kind of formal. And so the fact that, introduced to you and when I first met you, and the fact that we just clicked immediately, and when we started telling our stories, how they just aligned, and we talked about our values and the things that we do, and the fact that you practice lifestyle medicine, because that's a big piece of naturopathic medicine. Again, it was a match made in heaven. I will say it's definitely divine order. And I think that's why we get along so well, is because our values are aligned. The way that we practice, even though we're trained differently, the things that we focus on with our patients or with my clients are very similar. And I think as a result, that's why our patients and our clients are so happy with the care that they get from us, because it's not so bland, for lack of a better word.
Right. And it's not piecemeal. It's not like, a lot of times it's like, okay, I do this, then you do that. It's evolving and becoming more collaborative as we kind of figure out how that works.
Yes.
But it's really been beautiful, because I've learned a lot from you personally, because there's a lot of things and gaps in my training that do not explain, or that I cannot explain. Like, for instance, one of the things we'll talk about in the future is GI health and gut health. And
yes.
And that's a evolving topic, and more people are taking an interest in it. It's becoming more mainstream in medicine, but that's nothing new to naturopath, and it's nothing new to integrative medicine, in fact. And so I'm going down that integrative medicine route. So we'll see how that looks in the future.
I'm so excited for you.
I know. So we share some patients and clients, and that's a growing population for us. That's not necessarily what it started off. I mean, it was just really, you were just looking for someone to be that collaborating
supervisor, if you will.
Yeah. And I'm not completely comfortable with that, because we both have a lot to learn from each other. So people who have multiple chronic diseases, and especially when they're lifestyle related, are great opportunities for overlap for us, right?
Absolutely.
And I think that's really the roots of what we're so connected on, is that lifestyle piece, the taking care of self and the prevention of these chronic diseases, and preventing them from ever even being an issue, and helping people walk that path of becoming more holistically healthy.
Yes.
Traditional medicine has not really been on that path, right?
Unfortunately, I find that a lot of times medical doctors are practicing more reactively.
Yes.
Right?
Yes.
Where you and I, again, have the value and understand the importance of doing things and optimizing people's health so that they can be proactive, right? Like you said, and potentially prevent chronic disease from developing, or even if they already have a chronic disease, improving their symptoms and just their quality of life by addressing their lifestyle. That's a big piece of what I learned when I went to medical school, because I'm going to be honest, I was under the impression that I was just going to go to school and learn how to replace medicine with supplements. And when I got there, I got a big wake-up call. It is not that at all. I mean, definitely I use supplements, but I think I use them way less than many of my colleagues even do, because I understand that the foundation, the food that people eat, if they drink water, do you even go outside and breathe fresh air? Do you know how to manage your stress? Do you have community, right?
All of these sounds an awful lot like lifestyle principles.
Right? But all of these things are so important, and they're so neglected, especially in our culture. It's like, whatever. Don't worry about that. Just eat this trash fast food. Yes. Don't drink water. Drink pop or juice. And so
one of my biggest gripes is, a lot of us in the traditional side of medicine are probably tainted by the notion of, someone coming from your angle is going to be pushing supplements. And I mean, there are physicians out there who are practicing that form of medicine, supplement our way to good health. That is not how you get healthy, people.
Exactly.
It's supplements. Yes. It's in addition to, right? Yes. So, and I've I need to coin this somehow, but you can't supplement your way to good health. You need to have that foundation first. And I just described this to my bonus son. I said to him, he was asking me about some sort of supplements, and my bonus daughter too. And I asked you about that stuff too. And I said, guys, when you build a house, do you put the roof on first or do you put the foundation in first? Right.
Yes.
And so all those things, that sleep, that regular exercise, that good whole food nutrition, that is the foundation. Build that first. And then there are still vacancies or things you can't fill or needs you have, you can supplement on top of that.
Absolutely.
Yeah.
Absolutely. One of the things that I like to tell my clients is I don't think that people should be on a plethora of pills, period, whether they're prescription pills or whether they're natural supplements. It is so amazing when potential clients or new clients come to see me and they bring this like two-sided paper and it's all supplements. Mm-hmm. And then they want me to add more on top of that. And no.
Or they'll say, here's my contradiction here. I don't want to take any medications, doctor.
Yes.
But I do take 20 supplements.
Yes.
Okay. Wait a minute. So tell me why that doesn't make a lot of sense.
Well, number one, who has time in their day? If you live here in America, especially in our busy go culture, who has a time to pop 20 different pills 2-3 times a day? Mm-hmm. Number one. Number two, let's talk about financial stability, because finances are a part of holistic health as well, right? Mm-hmm. If you're spending $1,000 a month on these supplements, like, is that really sustainable? Is that feasible for you? And then just in general, there's only so much that your body can absorb in one bolus, right? Or in one amount of pills. Yeah. And so you're wasting your money a lot of times.
Have you ever told people that they have expensive urine?
I haven't, but I know that you have said that.
I have. Yes, definitely. And probably poop also.
Oh, absolutely. Absolutely. So, I take supplements myself. I'm not on 7,500. Mm-hmm. I might take 5 in a day, but there's a reason why. And I understand the reason why. And that's it, right? Like, I don't want to keep piling them on or, like I said, wasting money. So that's a big piece of education for my clients that I'm always sharing. And people weed themselves out. Because like I said, there are some people that really believe that all 55 of the pills that they take every day is keeping them healthy, and they're not willing to stop. And that's okay. If that's what you want to do, you have autonomy. It's just probably not going to work well with me.
Right. And I think that's really wise. And that's something that happens in medicine, although patients don't have the same, or don't feel like perhaps they have the same autonomy when it comes to medicine, because first of all, doctors getting to see a primary care doctor is very difficult, right? A lot of it is dictated by insurance when you're using your insurance to identify a primary care doctor and availability. So even if you do have a primary care doctor, you may not always be seeing your primary care doctor. You may be seeing one of their partners or one of the APPs in the office. So making decisions based on that in the context of primary care and preventive medicine is hard for patients. And that's where something like my practice is a little bit different. People are choosing to come to see me, and I'm helping you to determine if this relationship is a good fit in the same fashion. Because if you're looking for a doctor who is going to be prescribing tons of supplements in lieu of completely any medications at all, I'm not the one. If you're looking for someone who's going to weigh the pros and cons of each and try to guide you to the best of my knowledge and ability to minimize your need for prescription medications and help you optimize the supplements to the best of my knowledge, I'll help you do that. And if you're looking for someone who's going to help you prevent or avoid or perhaps even reverse some chronic conditions, I am the one. So unfortunately, reality is not everyone's willing to put in the work.
Absolutely. That's a huge piece right there. And it's something that I tell all of the prospective clients that I see. I've got a whole spiel, but the end all be all is 99% of these things that I recommend, whether it's you got to change your diet or you need to start moving or you're going to take these supplements for a couple of months. All of those things they have to do themselves. I can't come to your house every day and open the supplement bottle and force you to take them.
No.
And what people don't realize is that true optimization of health is an investment.
Yes.
And, right? You can either invest your time now and a little bit of money, or you can keep doing what you're doing and potentially something bad will develop, a chronic disease will develop, God forbid something like cancer, starts to grow. And then
Yeah.
you are truly, really, that's a huge investment now, because now your time and your money and your insurance is being used to help you deal with the symptoms and just what all has transpired, basically. The fact that you mentioned the work is just huge. And again, for some people, they think that all the work is twist open the bottle. I'm just going to twist open this bottle of natural stuff now instead of this prescription
And we are
bottle.
calling some people out right now. And I'm going to tell you, if I wish I had my coffee mug, I have a coffee mug that says sorry, not sorry. You know what? I might make some people upset, but you know what? It's the reality. Your solution is not, I don't care what it is. It's not in a pill bottle.
Absolutely.
It is not.
Absolutely.
Now, there might be an exception there to a few things like thyroid disease. You're going to need the pill bottle.
Right.
You need that pill bottle. But for the majority of things, that is not the case. So I'm listening to Peter Attia's book, Outlive, and I've listened to some of his podcasts. They're really long, super helpful, though, super informative. And I'm really excited that I've heard his name before, and he's an MD. He was actually originally a surgeon, and now he practices, actually, I'm not sure what, I think he practices longevity. He talks about medicine in terms of medicine 1.0, 2.0, 3.0, whereas in medicine 2.0, which is what we're kind of in right now, is more about the afterthought, like you said, kind of treating, reactive and treating things out as they appear. Like, oh, now you've got diabetes. Let's do something about it. Whereas medicine 3.0 is about being proactive.
Yes.
And he says something in one of his chapters where it really resonated with me. It was really profound. And it relates to one of our patients. And it's part of the reason it struck me so strongly is just because you do all these good things, it doesn't mean that you are going to avoid all chronic diseases and completely avoid illnesses. There are certain things that are just a factor of age because our cells, they age and there is deterioration that goes along with that. I often equate things to a car, right? You understand the concept of a car. Brakes wear out. You need to replace the oil. I mean, granted, fortunately, by the grace of God, we are much more resilient than a car, right?
Yes.
But things like cancer still happen.
Absolutely.
Right. And so we're not telling you this is a miracle cure to prevent all things, but hopefully to delay onset and improve your longevity and your well-being for longer.
I'm so glad you mentioned that. So it makes me think of a client that I used to have. Unfortunately, she had colorectal cancer and this was her second bout. And so she was it really took her down mentally. And, she was like, well, I do all the things, right? And so I don't understand why I have cancer. And I told her, like you said, there's nothing that you can do that is going to guarantee that you're going to be 100% healthy for the rest of your life. But with that being said, if you are taking care of yourself and you're doing things to make sure that your body is working as optimally as possible, maybe the cancer is not as severe as it would have been, right? If she had not been doing the things that she was doing. Because thankfully, if I remember correctly, it was like a stage 1 cancer. It was localized. It hadn't metastasized into the lymph nodes or anywhere else. And so they were just able to go in and remove the cancer versus if she had not been eating fiber and, not eating a diverse diet of colorful vegetables and fruits and things, maybe it could have been worse. So I'm just so glad that you mentioned that, because that's the other thing that I share with my prospective clients. I don't have any magic pill that I'm going to give you that's going to make everything better. Nothing in life happens like that. Everything that is worth doing requires some sort of work, right? And so this is why I love you, because we're so on the same page about these things. And this is not anything that we've kind of like hardcore discussed before.
No. I mean, I wasn't worried. I knew it'd work out great.
Of course, because again, we just are so aligned. So anyway, yes, again, the beauty of being proactive and working on things now is again, once you've got it down and it's part of your routine, you don't really have to think about it. It's not a hardship. And if you decide to wait until disease has set in, right now you've got the stress of the disease on your body, you have the stress of the disease mentally, and now you're trying to fumble and change all of these things, and it can be very difficult. The other thing that I just love to share with my clients that have families is incorporate your family in the things that you're doing. If you've never exercised before, start taking walks and take your children with you. Like, help them cultivate the habits early so that they don't have to do what you're doing, which is turn 40 and then struggle to like change your lifestyle or, whatever the case is. So
trying to learn habits that you didn't create when you were younger. And that is so powerful, because that is a huge part of what I counsel women on, especially because a lot of my clients, and, I was doing a lot more coaching. I'm kind of phasing back on coaching and focusing more on the practice and incorporating a lot of these principles into my practice, because really primary care and prevention and treating of the whole person is my passion, right? I think you and I talked about this. And the reality is that for a lot of women, they are, especially if they're mothers and wives, they're kind of like the heart of the house, right? The heart of the household, and put a lot of weight on their shoulders to do everything for everyone else. And again, don't take care of themselves. And in that process, if they're not healthy, it's hard for the whole household to be healthy in the full sense. And there's, one spouse might be doing things and the other spouse might not be doing things because maybe they're carrying the burden of keeping everything else together. So I encourage, this should be a family affair, right? How do we make this for the whole family? Because you're really in this together. Once you have joined, bond, and connected with another human being, it is no longer just about you, because your well-being is tied to that other person's well-being.
So true.
Which is why men who are married live longer. Hello. But women live less, live shorter.
Oh, well,
fix that. We got to fix that. It's really imperative that you try to involve your whole family. Again, it's not just about you. And then, it can include extended family. So, for my friends, colleagues out there who are not married or don't have children, have extended relatives, have close friends, do this with other people, share health and share life with other people. Again, that's the health community piece, right? The social piece. Bring it all together. You'll do better that way.
Yes.
Okay. So like along those same lines of patients that we can commonly help, and the fact that just because you're doing all these things doesn't mean you're going to prevent chronic things from happening. Another category of folks that are good for us to collaborate on, people with chronic pain or people with, I was going to say cancer. We talked about cancer and diseases that have significant side effects, right?
Right.
So and I think that's something that's not touched upon very often, is that, when you're embarking on some of these treatments, that's the reality of it, is that you're going to have significant side effects. So tell me about what you have to offer for patients who are undergoing those kind of therapies.
Absolutely. So first thing I do want to say is that I do not treat cancer, because there's this expectation sometimes that because I'm doing stuff naturally, that I can somehow treat cancer naturally. And so that's the first thing that I always like to share and educate people on. But it's exactly what you said. A lot of times when people are going through chemotherapy, it's a very strong therapy. And so it is not only attacking the cancer, right? It definitely decimates the GI tract. And so there are certain things that I may recommend to help mitigate those side effects, or to help people's tissues and organs kind of bounce back from that. Also, I'm just thinking things like, peripheral neuropathy a lot of times can be a result of maybe like radiation. And so I very much loved to use my acupuncture skills in that respect. I think of a previous client that I had. She had breast cancer. She is a thriver, so she survived and is still doing well as far as I know, but that peripheral neuropathy, that numbness and tingling was really prominent in her hands and feet. And so we did some acupuncture. We did a little bit of support with some supplements. And I mean, it was pretty immediate. She turned it like reversed. And she's, like I said, she's been doing great ever since. So there are things like that I love to do with my cancer care clients, but also there are some natural things that are actually helpful and can help strengthen the chemotherapy or just the anti-cancer therapies, right? And so those are things that we can talk about and discuss too. It all just depends on the individual. And that's another thing that I think is so beautiful about the way that we both practice, is that we definitely are individualizing the care for our patients and our clients.
Exactly. It's not one size fits all.
Right.
Do you manage anything or help people with chronic pain or people who have had a history of opioid use or dependence?
I have not yet worked with anyone with a history of opioid, like, dependence, I'll say. Definitely, I've had some clients that have used opioids in the past. But yes, I'm very familiar with that. Again, it's a combination of things a lot of times. I'm always recommending the acupuncture because acupuncture is amazing for pain, but it's like every other therapy. It's not a one-time thing. I can't just put 5 needles in and you're no longer in pain ever again in your life. It builds again, just like any other therapy. If you could go to the gym and lose all the weight in one visit, we wouldn't have gyms.
Trainers, you have all those things, right?
Yes, but then there's support that I can provide at different levels. So if it's a muscular or a joint related pain, right, I can support at that level. But sometimes pain, especially if it's like a chronic pain syndrome, is more at a central nervous system level, right? And so there's actually support that can be provided there too. Again, it just really depends on the person. And I think this is an example of the power of how integrative care can be so successful and be so helpful. Is, maybe initially the person is on some pharmaceuticals to help them manage their pain, but maybe they've been on it for a while, or it's just time to transition them off. And so having a practitioner that you can trust to help them while they're weaning off their medicine or, what have you, is, I think, an invaluable partnership to have. So.
Absolutely. And, for me, and I don't have as much chronic pain management as I used to, at least not the same fashion, because a lot of the patients have kind of self-selected, who are kind of the more, how do I go about this in the most natural way possible without being over-reliant on regular chronic use of pain medications. But having said that, there's still people that still need it from time to time.
Absolutely.
Pain is real, and it really comes down to threshold and chronicity. And then when it becomes an ongoing thing, what I have struggled with is helping people make the mental adjustment to transition to believe that they can be okay without the need of something chronically and long term, from a chronic pain medication standpoint, because there's a lot of fear that goes around that, right? It's a psychological dependency and just the fear of the pain. So that's kind of, and so there, that kind of like brings in, as wonderful and as helpful as all the things are that we can offer patients, we are not necessarily the end of the rope, like some or a one-stop shop.
Right.
Counseling, therapy, those are also really critical for a lot of our patients, which kind of brings us down to the next thing I was going to talk about, which is patients who have symptoms of fatigue, insomnia, GI distress, right? Those things are kind of like chronic migraines. They're like, there's a lot of overlap, right? In those groups.
Yeah.
We like both see a lot of patients that suffer from these kind of conditions. So let's talk about that a little bit.
Yeah.
So tell me what are your thoughts on managing patients with these conditions? How are they related? How are they not related? Kind of go from there.
Yeah. So I will say the first place that I always start with everybody, to not to beat a dead horse, but is those foundations, right? So I'm thinking of a client that I had young, in her early 20s, exhausted all the time, right? If I don't ask the questions, I don't know. And so I always ask, what do you eat? Let's do a 24-hour diet recall. Let's talk about what you eat, right? She don't eat breakfast. She doesn't eat lunch. She might eat dinner. Yeah, like, your body has no fuel.
Going to say that she was at least eating dinner.
Mostly, but there's some days that she just does. And I'm thinking, you're not hungry, but again, they're could be other things going on. There could be depression. There could be anxiety, which can totally, tank the.
Well, my favorite first question is, how are you sleeping?
That too. That's also another one that's so important.
How many people come with these complaints and are like, and they just want it to be everything else.
Mm-hmm.
Haven't stopped to consider that maybe 5 hours of sleep or 4 hours of sleep or the interrupted night of rest might be the first place to start.
Yeah.
Or working in an excessive number of hours continually. Like our body, we weren't meant to work 12 hours a day, 6 days a week.
Absolutely not.
And one of the worst things that we can do to people and society is create this work cycle without allowing time for rest and recovery, because our bodies do need that rest.
Absolutely.
Yeah, I'm with you. So starting with some of those foundational questions, what are some other foundational questions you might ask?
So in relation to the sleep, let's talk caffeine use, right? Because people are drinking coffee till 7 at night, You're drinking Monster energy drinks and who knows what else all day long. Caffeine keeps people awake. So and then you wonder why you can't go to sleep. You know what I mean?
Here's the other thing. They may fall asleep, but the caffeine, it changes the nature of your sleep too.
Right. They don't get deep enough.
Yes. So people don't understand, well, I fall asleep fine, but you're not really getting that sleep and rejuvenation. You're missing out on the REM sleep.
Yeah. Mm-hmm. One other thing, speaking of diet, right? One of the things that I often talk to people about is, when was the last meal that you ate? If you ate dinner at 6 and then you decide to go to bed at midnight and you haven't had anything to eat in between there, 9 times out of 10, if you're waking up around 3 or maybe 4 in the morning, it's probably because your blood sugar has dropped so low that your body is like, we need fuel. So again, it's just so important to address these basic things. But
I would say there's a little bit of nuance there, right? Because fasting and prolonged time restricted eating, people can function on that, but they have to optimize their body to do it.
Right.
And it really is heavily dependent on the foods that you're eating.
Yes.
So if that last meal that you ate was highly processed or super high in, simple carbohydrates, was low in protein, was low in complex carbohydrates, your body's not going to have the energy to sustain itself. Right. And on top of that, your body needs to be conditioned to utilize its energy stores. And so someone who's suffering from hypoglycemia or rapid glucose drops because they haven't had nutrition, that their body is not primed to be able to, kick out glucose from the liver, right?
So, yeah.
Staying that fast. So first of all, if you're doing it intentionally, you need to prep your body to do that. You can't just jump into it. And if your body's not doing that well, then I'm already thinking, oh, you're probably insulin resistant.
Man, that is huge. I think insulin resistance is so prevalent.
And I think it is.
And it's so overlooked, and it's so easy to check. Just
if you don't have diabetes, you're good. No.
You probably have insulin resistance, which is pre-diabetes.
Exactly. Oh my goodness. I could talk. We could have a whole episode. In fact, we should.
We will.
Resistance, because this is huge. So many Americans are suffering and dealing with insulin resistance. And this is one of the things that, again, Peter Attia, he's so spot on, talks about 1/3 of people who are obese or overweight actually don't have any metabolic syndrome or insulin resistance. Are actually metabolically healthy. And on the flip side, a number of people who are actually skinny or in the normal BMI range actually do have metabolic syndrome or metabolically unhealthy and have insulin resistance. So it's a multifactorial thing. It doesn't just come down to BMI and your weight. Insulin resistance is much more complicated than that. And it's just one factor in this whole paradigm of how poorly our diets and our lifestyle are, or how poor it is, and how much it actually contributes to our chronic disease burden as Americans in the United States and really worldwide. But this is where we function. This is where we operate. This is where we
absolutely. Yes. And coming back to the issues with like fatigue and things, this totally relates because blood sugar has a massive role on hormones and the way that our hormones function. And so if your blood sugar is dysregulated, and it's been dysregulated for a while, 9 times out of 10, this dysregulation is affecting the way that your body is able to secrete hormones. It might dysregulate that secretion and it will throw off your sleep. In addition to in ladies, right, can throw off the period. We see that all the time with PCOS. It's just the body is as an amazing system, but everything definitely is connected to everything else.
Exactly. Which is why I have a very difficult time just focusing on helping people be fit and lose weight if I can't take care of all of it. Right. So, and with that hormone balance of it, I mean, so the other side is true that hormones influence our body's ability to process glucose and influences insulin, for instance. You know, insulin's job is to shuttle sugar into our muscles, right? And we're consuming way too much glucose. It's going to get overburdened. It's going to become resistant to that. That's one mechanism of the resistance. But then there's also problems with high levels of cortisol, or if your sex hormones are off, or your thyroid hormones off. These also influences insulin's ability to do its job. So cortisol is a whole nother thing. Stress is, in my opinion, one of the most unrecognized, underappreciated factors in weight management, metabolic diseases, all the things that we've talked about.
Everything.
Across the board, stress, right? I mean, again, that's a whole nother topic. Make sure you keep note of this.
Got it.
It's almost frustrating. And maybe almost isn't the right word. It really is frustrating because I feel bad for what people are dealing with because, you know, society and even our food supply, it's just not making it easy.
No, it doesn't.
Do all these things well. And it is an uphill battle.
It totally is.
Yes. And I feel almost, I don't know how to describe it, but I want to help people so much. And it's really hard. And one of my biggest fears or challenges is not being able to help people because of all the things they need to overcome.
Yeah, it can definitely be overwhelming. And that's why I like to emphasize the fact that this is not a simple thing, that like this is not just a 1 or 2 visit sort of thing. I want to build a relationship and a rapport with my clients so that we can address all of these things, because some of these things people don't feel comfortable talking about. If we touch briefly on stress, which is something I was thinking about in regards to fatigue too, depending on where your stressors are coming from, if you recognize it or not, right? Some things we just don't necessarily feel comfortable talking about, or we feel like our healthcare providers might not understand where we're coming from. And so again, establishing a good relationship and making sure that my clients feel comfortable when they're talking to me is just such an integral part of what I do. Coming back to the stress, though, really interesting. One thing we didn't talk about was autoimmune disease. And so just saw this recently. A friend of mine shared this, but there was an article based off of a study that Stanford University did, and they have identified that there is a part of the X chromosome that can trigger autoimmune disease. And so they are basically suggesting that this is part of the reason why autoimmune disease is so prevalent in women. And they were saying that the trigger for this piece of this chromosome that can start the autoimmune cascade oftentimes is influenced by repressed emotions and like the stress that women carry, right? Which we were just talking about.
That is old news. No.
I know, but like it's not for people.
I know. So it's old news to us.
Correct.
But yeah, so I'm gonna go out and throw another book out there 2 books. So When the Body Says No is a great book written by another physician that talks about that very topic and highlights. I mean, and he didn't do any rigorous research studies. I mean, he highlights all this in his clinical experience and talks about the influence of repressed emotions and the high prevalence of these conditions in women, because women also being, again,
The jugglers.
Those emotions, juggling all the things, putting other people first, being the caretakers. Because I'm sorry, I don't care whether you have children or not,
Right.
whether you are married or single. As a woman, you inherently and I fought this for decades. It is in our nature to take care of others, right? Which is why we make great doctors and why we make great physicians, because this is what we do.
Yeah, yeah.
In doing that, we have to make sure not to compromise ourselves. And I've been guilty of that countless times. So, I mean, I've been on this journey of trying to heal myself for years, which is what I bring to the table, is why I'm so passionate about helping other women, especially physicians, especially high achieving women out there, because you're juggling so many things, right? And so you are more likely to encounter all this stuff.
Absolutely.
Because you're putting self-care on the back burner. And self-care is not a one-time event, right?
No, it should be a daily event. Daily. So I consider myself like a stress management warrior, if you will, or like super hardcore advocate, because I'm very similar to you. I am a single woman. I don't have any children, but I have drugged myself off of the edge of burnout many times. And if I'm being candid, I feel like I do that at least once a year. Just pull myself back from the edge, right?
But a week now.
But so I'm so passionate. And when I do speak and like have speaking engagements, a lot of times it's to women. And I'm always talking about how they need to actively do things for self-care, for stress management, for relaxation. Take time for yourself. And this is something.
Let go of perfection, please.
Yes. Reformed perfectionist here. I proudly say that.
Right here. Me too. With the exception of editing my podcast, I still struggle with that one.
That's okay. But yes, it's just so important. I've never heard anybody ever say this. I should coin this or something, but I always am sharing with my clients, I want you to bookend your day with stress management or with self-care, right?
Well,
and the morning session, if you will, is to kind of set your intention for the day. What do you want to happen? What do you want to put out there? What energy do you want to put out and receive, right? But then the evening part is more about clearing what has accumulated throughout the day. Because no matter what your intention is, sometimes things don't go the way that you want them to go. 9 times out of 10, something's not going to go the way that you want it to go. And so, if you
say that,
I told you I love it. If you can book into your day, then you're being proactive at the beginning of the day and a little reactive at the end of the day. But again, you're being proactive about clearing and purging this stuff from your body. Because if you don't purge it, it's going to manifest somehow.
Oh my goodness. That is so give me some examples, like some strategies someone could use at the beginning of the day, like real quick, easy, practical things, and something at the end of the day to do that.
So a lot of people have a spiritual practice already, right? Whether it is prayer or it's meditation. I know some people do devotionals, right? So if you are already doing that first thing in the morning, great. That's a wonderful way to kind of set your intention, depending on what you're meditating on or what you're focusing on. But then if you want to, you can do like the actress Jennifer Lewis does when she's brushing her teeth and she affirms herself in the mirror, right? There's just so many easy, small places where you can do things throughout the day that people don't think about. So that's one, right? You can say some affirmations, you can do your devotional, go on about your day. And then at the end of the day, it could be something as simple as, kind of to incorporate what we talked about, go for a walk with your family. Right?
And like a walk after your meal is a great way to lower your blood sugar. So.
Yes, I was going to say that. Yeah. Come on! But the other things that I also I really like to recommend to people is journaling. So you can journal in the morning too, right? And again, if something's on your mind, journal to get it out, or choose a prompt like, I don't know, 3 things I'm proud of, and prompt write. But you can do the same thing in the evening. But I find for my people that are struggling with fatigue or like insomnia or something, and if they're ruminators, let's write out what you're ruminating about, right?
And that piece of advice to people countless times. So like I would prefer not to have your phone because it's too easy to get caught in the technology thing. But if you have a notebook or notepad next to your bedside, and if you find yourself ruminating on things, take those thoughts and write them on paper and literally tell yourself, okay, I'll put it here so I can deal with that tomorrow.
Tomorrow, yes. Or if you're a list maker, right? Instead of trying to keep it all in your brain and you're thinking about it in the middle of the night, oh shoot, I forgot I got to get eggs in the morning. Write it down.
Yeah, get out of your head. Yeah.
So easy.
If you're the other person, please keep a notebook next to your bedstand in your or whatever. Just simple.
Or a piece of printer paper. It doesn't have to be anything fancy.
It's always the back of some other piece of scrap paper, something that I need to keep.
Oh gosh, don't do that.
I'm so bad.
That's okay, but
this is a point. Just because we're giving the advice doesn't mean we're doing it perfectly, right?
Correct.
Right. And so there's always room for improvement. And don't think just because you're not doing things perfectly or doing it consistently all the time, that doesn't make you a bad person. It doesn't mean that you're not capable of doing it. It's this constant striving for getting better.
Yes.
Right. And so I was going to kind of add in a similar fashion, like the morning things. I love what you said about the morning stuff. And I would add, like, in that morning, I think one thing that you should do, at any point, whether it's drinking your cup of coffee, if you're a coffee drinker, eating your breakfast, getting ready, is what is the one thing that I want to get out of today? Like, what if, whether it's something from your list or something that you want to accomplish, because that helps to focus your energy. And so that, and if you've already decided that in your mind and maybe even written it down in your journal, it's going to help avoid those distractions and those things that are going to deter you and take you off track, because you have this focus. Doesn't mean you're not going to do these other things, but you're going to be more mindful and intentional about turning down things and putting up boundaries that are going to get in the way of that.
Yes, that's so good. That's so good.
Yeah, I love it.
And it's so simple. So simple.
Yes. And people might think, oh, that's, negates things because they sound so simple. There's no way that's going to help. Well, you would be amazed.
Just try it.
Yes.
Exactly.
Awesome. So if people listening to this haven't already figured out why it's beneficial for an MD and an ND, or I guess a DO and an ND to collaborate, and why there's benefits there. It's for MDs and DOs and DOs tend to be more holistic, I would say, just by their training. But if you're in medicine and in traditional practice, there's often not enough time and free play, and even in our training to address all these things that people, quite frankly, patients want more of, and we are finding more beneficial being more proactive, because traditional medicine is focused on being reactive. I'm convinced. And I'm a part of that group of people out there who are trying to push it towards being more proactive. But if you're working with the ND, you're going to get access to that whole body approach to health. You are going to prioritize and have more knowledge and experience with how to incorporate some natural therapies. And correct me wrong, you have training in nutrition as well, right?
Absolutely.
That's a lot. In fact, zero training in medical school. I shouldn't say zero, but almost zero. But you have quite an extensive amount of training in nutrition.
I took 3 classes. I think it was 450 hours.
450 hours?
I think so. Some of these classes were really long, but yes.
Clinical nutrition training, okay? Behavioral medicine, you do a lot around behavior. And like we talked about, it's highly individualized. And you're also integrating traditional medicine and complementary medicine. This is not an all or nothing approach. Right. So these are all reasons, if you're not working with a naturopath, if you don't have a naturopath collaborator, you just making friends with somebody, because it could be a great resource, not only for you as a physician, but also you as a patient. And because you can provide a reference for your patients, but you can also take advantage of those resources and improve your care of folks, and also improve your care of yourself.
Absolutely. One thing I want to say, 2 things. First is I always encourage my clients to build their own team, right? Yeah. Build your own healthcare team. There's nothing wrong with that. We're all experts in our own fields, right? And so like we were talking about earlier, if you've got a medical doctor and you have a naturopathic doctor and you also have a therapist, Great. That's a great team. Let's say you got some musculoskeletal stuff going on. You need a physical therapist. You can add them to the team. Something that nobody talks about a lot in medicine is a dentist. Oral health is so important.
Everybody, if they've been to the dentist, I am not a dentist, but I value dental care.
Yes. It's the start of your digestive tract. But yes, so I would just say I love to recommend the team. But the other thing that I wanted to clarify is there are technically two paths of naturopathy.
Yes.
Right? So we have what we call licensed naturopathic doctors, which is what I am. Like I said, I went to a U.S. Department of Education accredited school. I had to take board exams. I had 4 years of training. I learned all the sciences. So I was in cadaver lab. We was cutting folks up, right? I learned about pharmaceutical drugs, all of these things, right? Mm-hmm. But then there's another path that we call traditional naturopaths. And a lot of times they tend to attend an online school or maybe a hybrid school. There actually is one here in the state of Michigan, but that is hybrid. I think it's in Mount Pleasant, but they don't receive the same rigorous basic sciences and clinical sciences education that I received or that my colleagues receive. And they also do not, their programs are usually not accredited, and not saying that they don't desire to help people, not saying that they can't help people, but it's just important to ask those type of questions, because to just be frank, naturopathic doctors want to be able to be licensed in all 50 states. And the way to do that is, of course, we have to understand the conventional standard of care in order to be able to integrate our medicine into that, right? And so I say all of that to say, two paths. Make sure you ask your naturopath which way they went. And if they did happen to go the traditional route, they may not be the best clinicians for you. But again, I'm not saying that they can't educate, help you with some herbs, teach you about some things that I don't even know about, maybe reflexology or things of that nature. But I just like to make sure that people understand that there are two paths, because we're not the same and the standard of education is not the same.
I think that's a really important point of clarification, because I'm certain the majority of people don't know that, including
no clue.
Medical doctors, lay people, just across the board. So thank you for providing that clarification. So again, Dr. Carrie Denny is a licensed naturopathic doctor and a phenomenal human being, might I add.
Thank you.
You're welcome. So, we covered a lot of great stuff here today, and I hope that our listeners were kind of able to follow along, and kind of like key takeaways here. First of all, there is a growing trend toward collaboration, and I think that's important for all of medicine. Again, like you said, not just collaborating between traditional doctors, medical doctors, naturopathic doctors, but also with therapists, the physical therapists, and like the whole smorgasbord of individuals who are involved in primary care and prevention and taking care of the whole person. Because it really does take a team, because none of us we recognize that care and well-being is so much more complicated, and our society and it's gotten more complicated. So a lot of that, the knowledge, right? So like a lot of, that's not there anymore. We're not passing on. So we're increasingly relying on external people and to help support us in our well-being journey. So yeah, you probably do need a team, right? And that's something that we recognize, you and I, when it comes to our own well-being, what we recognize when it comes to taking care of our patients, which is why having this collaborative relationship has been so helpful. Also, the other point is that the differences between a licensed naturopath and a naturopathic doctor and someone who is a traditional naturopath. And so understanding that there is that they are two different groups of individuals, and that a licensed naturopath has very rigorous training, not much different, really very similar, a lot of overlap with medical school training in terms of the knowledge base required in order to get your license and to get your incomes and to complete your board exams. And there are a lot of areas where we overlap, and at this core, at the surface, at the foundation of what we want for people is not different, right?
Right.
We want people to be taking care of themselves, to manage their stress, to get good sleep, to eat well, to exercise regularly, to do all of these things. And that there is room for prescription medications, and there's room for supplements. And it's just a matter of navigating what is right for you at that time in your life, given your set of conditions and your predispositions, right?
Absolutely. I'm so glad you said that. One more point. Naturopathic doctors are not against pharmaceutical drugs.
Right. Right.
If I get hit by a Mack truck, don't bring me to my office. Take me to the hospital. Like I need more higher force interventions. I'm gonna definitely need some drugs. I'm gonna probably need some surgery. But right, if you have a naturopathic doctor on your team, there are things that we're trained to do to help, like speed up recovery after surgery, or again, to kind of adjunctively use to help people manage pain as a result of their injuries and stuff. So anyway, I just want to put that out there because that's a big misconception that we just don't care about pharmaceuticals, and they're important.
Right. No, I so appreciate that you said that. And in a similar fashion, I don't think that I do believe that there is room for using supplements, but again, not in lieu of doing all these other things first. Right. So, all right. Awesome. Anything else you want to add?
No, I just thank you so much for having me. Like I said, I always enjoy it when we put our minds together and have a wonderful conversation, because that's what we do.
Yes, it's so much fun. I just could do this like every day. All right, cool. So we'll have to schedule or plan our next episode. We'll talk about one of those 2 topics. Gosh, actually, we have like 3 topics in mind. Just so many things. We'll just keep talking.
Yes, I was going to say, we'll just keep going.
Just keep going. No shortage of things to talk about. All right. So I hope that you all found this episode helpful. If you want to find Dr. Carrie Denny, can you tell them your website?
Yeah. So my website is vibrantwellnessmi for Michigan.com. So mi.com. You can find me on Instagram and Facebook with @CDennie. So DENNIE. ND is the, what do you call that, handle? I'm also on LinkedIn too, but you just search my name. But that's where you can find me.
And as you recall, I am Dr. Angela Andrews, the Lifestyle MD. You can find me on Instagram. I think it's Angela Lifestyle MD on Instagram. And then also we have this podcast. I do have a practice, Seeds of Health, Direct Primary Care, that is in Grand Rapids, Michigan. That's www.sohdpc.com. All right. Looking forward to our next talk. Thank you.
Thank you. Have a good day.
You too. Bye. This has been another episode of The Lifestyle MD. Special thank you to Lou Musa for the show theme music, created with Bree Photography and makeup by Janae for the cover photo. And if you enjoyed this podcast and you haven't already, please subscribe today and share with another woman doctor who may benefit. You may also follow me on Instagram @Angela Lifestyle MD. I am Dr. Angela. Thank you for joining me today.